Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. We've actually haven't seen each other in a couple weeks.
That's right. We had a little bit of vacation, if you
Yes.
will, from the In the Sterilization Room with Jackie video episodes. So it's good to be back and review the current information that's happened in the last 2 weeks.
Exactly. And there's actually some news, or there've been a lot of rumors, news, and some new published information coming out of OSHA in the last couple of weeks. And so we're going to get into what should orthodontic offices know. Let's start there.
Okay, well, we're still in the pandemic, obviously, and as we've discussed over our previous episodes, we go by with this airborne aerosol disease transmission. What's the risk? How do you practice safely and for both patients and team members? We've discussed a lot of topics in the last year. This is really the 1-year anniversary, if you will, of COVID-19 being declared a global pandemic with it. And OSHA ensures the safety of workers in the United States. It comes under the U.S. Department of Labor, and OSHA has published interim guidance throughout the pandemic and updated that as more information became available about how to provide a safe work environment and what we need to do to have that safe work environment. Now, in the last couple of weeks, there have been a lot of rumors, as you mentioned, about OSHA publishing a new standard. And it was going to be an emergency temporary standard on COVID-19 safety measures that need to be provided for workers. And OSHA had a deadline of this Monday to be able to publish that or to submit that new temporary standard. And OSHA let the deadline pass. For probably multiple reasons, but I think one of them was that there does need to be more data and research before a standard, which becomes a law, is implemented. That could be burdensome to employers, could be difficult to manage, and could be questionable about how much protection does that barrier or that particular safety protocol really provide for worker standards. So OSHA did not issue that emergency temporary standard, if you will, but OSHA did on March 12th publish a new directive that went to all of their OSHA offices on COVID-19 safety.
Okay. So what does that directive then, what should orthodontic offices know about it?
Well, it's confusing when you hear all of the different government terms, right?
Yeah.
A directive issued by OSHA goes out for any hazard over the years, and it's guidance that they provide to their OSHA offices, both federal OSHA offices and state OSHA offices, and to the inspectors, to the managers at those regional and state offices on what they should be focused on for safety issues and new topics of safety issues and what they should be looking at when they do inspections. So the directive was sent out to federal OSHA offices. 24 of the states have federal compliance and 26 of the states have state compliance, such as California has Cal OSHA, Washington State has WSHA, and Tennessee has TOSHA. So they may have published their own OSHA COVID-19 safety precautions. Oregon and Virginia were one of the first state compliance to publish their own OSHA COVID-19 safety guidance with it. And in January the 29th, what OSHA did was to update worker safety with it. But now going back to the directive, okay, so this is instructions sent out to the OSHA offices. It talked about safety measures that inspectors should look at when they go to do inspections. And part of that directive said that of the inspections that are coming up in the future months, that 5% of that OSHA state or regional inspections should be directed at high COVID-19 hazard employment situations.
Okay.
And the top priority in there was healthcare.
Mm.
Because we've heard in the media and the news over the last year about the number of infections that were transmitted in nursing homes,
Right.
in
Yeah.
hospitals. And so that went at the very top priority. And where are all of those aerosols being generated? And if you look at Appendix 1, the chart of the top priority for OSHA inspections, physicians' offices is listed as number 1, and dental offices is listed as number 2.
Ah, okay.
So there could be more inspections. I would tell orthodontic offices to anticipate that you may have an unscheduled random inspection of your orthodontic office and that you need to be prepared for that. Basically, you need to be prepared with the bloodborne pathogens protection, which is infection control, hazard communication, which is chemical safety, and then general safety, that's your fire and emergency preparedness, and now respiratory protection or COVID-19 preparedness, and have that plan in place according to the OSHA website with it. So I would urge all orthodontic offices, if they haven't updated their standard to include what they need to be doing to mitigate COVID-19 disease transmission for employees in their office, that they do need to update that plan in their OSHA manual and with their training for employees.
Okay. So the the January 29th
Yes.
guidance from OSHA actually kind of gets into the elements of a COVID-19 prevention program. Can you talk about which one of those orthodontic offices should be looking at to prepare for that potential OSHA inspection?
Yes, if you'll give all of the listeners, the viewers on this, the link to that OSHA webpage. It's a safe work webpage, and it actually lists what safety protocols should be covered in there, and then that's the A through H. And in there, things that we've already done in the orthodontic office, such as install barriers where you have to be in contact with another person. So we've installed barriers at the front desk.
Right.
We've installed barriers in the orthodontic office, even between treatment chairs, to limit aerosol spread. So all of these things, elements we've put in place, but we just need to review them. And then OSHA went further, as you would scroll down that OSHA webpage, and there are actually 16 elements that are listed that should be in your OSHA safety program for COVID-19 safety. And number 1 in there is to appoint a team member or an employee that oversees all of those safety measures. And then you have a written plan. And I'd like to go down to item number 3. And if you can sort of bring that up that all of the viewers could see it, item number 3 is where OSHA talks about hierarchy of controls. OSHA always looks at what's the top hazard and then puts in a hierarchy of controls from eliminating that hazard to substitution of the hazard, to administrative controls, and then at the very bottom of the hierarchy is personal protective equipment, because it can be there can be limitations of each of those hazards as you go down the hierarchy. And so that gives a good outline for what orthodontic offices need to implement. Then if we look at number 6, that's where I'm getting a lot of calls from orthodontic offices and from the OSHA coordinator. Jackie, we need to be able to document our education and training.
Right.
That's number 6. OSHA has actually said that the orthodontic team needs to be educated on COVID-19 safety measures. And so that's aerosol, airborne disease transmission, and what you're doing in the orthodontic office. So that could include wearing those N95 respirators when you're doing aerosol generating procedures, using high volume evacuation that's going to reduce the aerosols that you're exposed to, how you schedule patients. Limiting the flow of patients in the office so that we don't have multiple unmasked patients stacked up, if you will, in the orthodontic schedule. We're still screening all patients and employees for temperatures and for symptoms as they come into the orthodontic office. So that was number 6. And
Okay.
then we go down to number 10. Oh, and let me back up a little bit on that before I leave number
Okay.
6.
Yeah.
The other part of providing education and training was to provide education to the team members on the vaccines. And what are the
Okay.
vaccines that are available now that we have the vaccine?
Mhm.
And what's the difference between the vaccine and the safety of the vaccine? And
Yeah.
when it's available in your state to
Okay.
the orthodontist and the orthodontic team members.
Right.
So, we have 3 vaccines available now. The Pfizer and the Moderna are messenger RNA vaccines. And
Mhm.
then the J&J or Janssen vaccine is a virus that is attenuated, if you will, but it does have it's a recombinant type form that does provide protection
Mhm.
as a traditional, say, influenza virus. It's the same type of
Okay.
formulation that you
Mhm.
would have for a measles or an influenza virus. So
Okay.
a different type of vaccine,
Mhm.
and it's 66% effective. And what all 3 of those vaccines, the protection that they provide is not that it just prevents you from getting an infection. If you did acquire an infection, because none of the vaccines are 100% protective,
Yeah.
then you're going to have much less symptoms. Your infection would not require hospitalization. And of course, it's going to prevent deaths.
Yeah.
So, big protection there from COVID-19 infections with it. And so then we're going to go down to the other 10 through 15
Mhm.
elements of protection, and that's really providing training for the employees and information on enhanced infection methods, what we're doing, like disinfecting the reception room. Prior to COVID, we disinfected our operatory and our units, but we didn't always go out and every 2 hours wipe down the reception room.
Ah, okay, true. Yeah.
And having a touchless check-in,
Mm-hmm.
all of those measures that we're doing, and then also including information on testing for COVID-19
Okay.
and information on the vaccine and the vaccine safety. So the OSHA Safe Work webpage is a great outline for putting together your OSHA program, your OSHA written respiratory protection plan for offices. It's not lengthy, and I would highly recommend to every orthodontic practice that they keep the link and
Mm-hmm.
maybe even print out the pages and put it in that respiratory protection plan. That's going to be a new segment to their OSHA manual. So
Yeah.
as they get prepared for these potential OSHA inspections, priority is to have a respiratory protection plan, to be able to document that you provided training to employees on how the COVID-19 disease is transmitted,
Mm-hmm.
what are the elements that you're doing to protect, and what training have you provided to employees on the vaccine and the availability of the vaccine.
Yeah.
And so OSHA inspectors will always look for the paperwork.
Yeah.
That's one of their first priorities when they come in. So don't ignore the rest of your OSHA safety program. Make certain that you provided that updated comprehensive training. I just did a full 4-hour training for Whitney Orthodontics, and
Mhm.
we're going, oh my gosh, we never realized we had so much information, safety information that we needed to update. But it was comprehensive. We went through
Yeah.
everything on infection control and sterilization, and from sharps containers to chemical labeling and respiratory protection. So
Yeah.
make certain that your annual up-to-date training, that you have that documentation, and you have all of the information that should an OSHA inspector want to see that, you could provide it to them should you have an inspection.
Okay. Well, Jackie, I think this is really timely and great information because, this OSHA is going to be there. And so it's best to be prepared. So, and honestly, I mean, I was looking at the document, the January 29th document with you, and looking through those 16 things, it really is a good template. So I think, if the practices just take the time to go through it, they'll be fine. So, but
Yeah, it's
yeah.
just like with all government agencies, they want a written program.
Hmm.
And we tend to be so busy in the orthodontic office,
Yeah.
Allison. We're busy providing that patient care, and our patients are the first priority, and paperwork gets pushed to the side. Well,
Right.
this is one time to update that paperwork,
Yeah.
update your training, and then get back to caring for all your patients.
Exactly. Well, thank you so much. We will be back next week with the next, or soon, with the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.